So hello everyone, my name is Slovensky and I am the Emergency Medical Services Director here at Stony Brook Medicine. And I'm tasked with, one of the principals tasked with the operations of the mobile stroke units that we'll be deploying. Two of the questions that I get asked the most is why and how. Dr. Guido did a great job of saying the why piece, and we'll go into the how piece next. So the goals of the program, clearly speed is one of the most important things. We need to be have the mobile stroke unit deployed as quickly as possible, and we're looking to simultaneously dispatch these two units on 911 calls in their given areas. So the simultaneous dispatch allows them to respond with the local ambulance agency and hopefully decrease the time frame to getting the stroke care. They will rapidly assess the patient and assess if they need TPA or not. And the other piece is that the large vessel occlusions identified in the CT scanner will allow them to quickly provide the ambulance. We'll be deploying two mobile stroke scanners with TPA on board, telemedicine, video conferencing, K-Centra, and head and perfusion scanning abilities. You look from the picture, so the three major components are the mobile stroke unit, the connectivity, and the telemedicine video piece. Some of the technologies involved in that, clearly the connectivity is a big piece of this. And we've worked with the networking group and the people in the hospital to pick different vendors to be able to do this. There's the AT&T FirstNet system, which is the first responder program that allow us to hopefully get these images back quickly. Some pictures of the mobile stroke units. If you look on the picture on the left there is the picture of the ambulance with the scanner in the back. And to the right there is the inside of the ambulance with the X10, Cisco S10 video camera. The physician in the hospital will have video conferencing capabilities in the ambulance, and they'll be able to read the CT scan, enter orders, and enter their physician notes as needed. So some of the challenges that we've come across. The IT functionality is a big piece. Clearly, we need connectivity all the time in the vehicle to be able to register the patient, access the EMR, enter medical orders, and care plans. The connectivity needs to be reliable, and we need it for all the functions. The scan needs to be transmitted back to the hospital. It needs to be read, the teleconferencing capabilities, and so forth. Probably the biggest challenge that we had is getting all the groups in the hospital, the interdisciplinary groups, to work together and towards a common goal. And the meetings that we had initially went from a small group of people in the end to sometimes 30 or 40 people, which has been challenging. And clearly we want to be able to collect as much data as possible to show the benefits to the system and the outcomes.